Assalamu alaikum everyone, welcome back to another reactions video. We have got two other great guests with us today. So starting first, I have got Aqsa. She has been a great junior at NHS and she's worked with me previously in one of my previous hospitals. So without further ado, Aqsa, please introduce yourself.
Hi, I'm Aqsa. As Dr. Saadat has stated, I've worked with him in the UK. Currently training as a GP in Bedfordshire, and decided to have a stab at this today.
Right, and the next person we have is none other than Monali. So she's been with us previously as well. So welcome, Monali, again. The first video, I think let's just in fact this is a picture, and let's start with that.
Shoaib is trolling me.
Wow.
Yeah, so that's the reaction I wanted to catch actually.
I was wondering, like, this is not a meme. This is a fact. Like, that's how.
Hey, your hair looks much better than that. Don't worry. He's just being a bully.
So, anyways, so you said that you look better.
Yeah, I agree.
She's right now. This is her post night. Are you saying you look better, Monali?
Oh, thank you.
Explain yourself.
नहीं तो अगर इसको मोनाली की पिक्चर को उठा के हम अगर मोनालिसा के ऊपर रख दें, अब नाम में भी स्पेलिंग भी मोर और लेस एक ही है, आगे से ली की जगह लीसा कर दिया ना, बस सिंपल डिफरेंस ही है. तो आपको लग रहा है कि ईयर शिफ्ट से यू आर जस्ट कमिंग आउट मोनालिसा से मैच हो रहा है यार, और क्या चाहिए जिंदगी में.
फेमस होना मैच होता है.
The famous last words by Shoaib Saadat. उसके बाद खत्म.
You can actually go and see it in Paris in the Louvre. It's a lot smaller than I originally thought.
Okay, let's see the next one.
Thank you.
Okay, so I think this is less of a meme and more of medical, linguistic lectures of sorts. Because इसमें idea ये बताया जा रहा है. I think I don't know basically means idiopathic in medical language. So this is what they are trying to explain. When was the last time you used this word? Any of you?
Yesterday.
Yesterday. Okay. And were you like successful in making a diagnosis?
That was idiopathic, chef. Idiopathic caused.
Idiopathic is a diagnosis in itself.
Query cause, query chest, query urine, query idiopathic.
Absolutely.
Query chest, query urine, query idiopathic. What did you do? You couldn't even rule out chest or urine? Yeah, just do a dip. That's one down.
You put like 4 or 5 queries in a single query, so you can imagine the type of query you'll get at the end of it. Okay. Okay, so I think probably Monali has already seen this.
Every Obs&Gynae trainee will be riveting at this one. Although the stitches are done very nicely.
Yeah, exactly. That's
very clean.
Very clean.
Very tidy. The scar will be very thin.
Pretty thin scar,
like
yeah. You can't even see that, to be honest.
No. But how many? Oh my god. 10 babies.
Okay. So did you guys ever actually attend one of these C-section procedures? Have you been to one of these?
So I had to during training. We had to go to, I think it was 10 C-sections and 10 natural births to get them signed off. I myself haven't done C-sections.
Okay.
But I have seen as well. Medical school.
Right. Right. Let's see the next one. So let's see who gets it.
Malaria. Mario.
Mario.
Luigi का है फिर.
Exactly. So if you see close enough, you can see that there is a little hat that this mosquito is wearing. And it's got an M written on top of it. There is another thing I think which is said about the health personnel. We are more of vampires than health personnel when it comes to blood sampling. Sometimes you guys must have done a lot of blood sampling.
Oh, I wonder why.
Yeah, exactly. I could not understand.
For a full screen, and that's usually when it's like.
Imagine.
Absolutely. The thing is that, I mean, when we've got, juniors, amazing juniors like yourselves, We don't need to do anything. Yeah? That's
just
the
suck
beauty
all the
of
blood.
medicine.
20 मिले.
20 bottle blood निकाल गया. No wonder why they're anemic, all of them.
Of course. And then it's sudden. He must have GI bleed. Now he needs a PR and he needs an endoscopy and he needs. It was all because Shoaib had requested too many bloods.
20 bottles of blood.
Oh my god.
COVID showing monkeypox around the workplace.
Oh my god.
Okay.
Oh my god. Please don't. I can't deal with another pandemic. No. He's like, yeah, please, this way and then this way and then and then just spread this way.
Yeah, COVID is showing the territory, like where you have to go. Like, you have to start with like China and then UK and then European countries and then US. Like, have you noticed how the COVID is so confident? Like, see.
This way, my friend. This way.
All right. Let's see the next one.
It's bacteria in 1928.
Okay.
Oh my god. This is renal summarized. No one starts on, Comox anymore. We'll start them on meropenem, and if that doesn't work, get cold micro.
Yeah, exactly.
No escalation plan. Tazocin, that's nothing now. What's Tazocin?
They have been taking Tazocin already, so start with meropenem.
Yes.
And then micro. Sometimes, if you're lucky, you just cold micro because already.
Oh my god. And then it's like, are they dialysis patients? Yes. Okay, so do we give it every day before dialysis, after dialysis? A bigger dose, miss out a day, a bigger dose? What we do? But yeah, no meropenem again. But look at that muscle. Dang.
Okay.
I mean that's a valid question. Especially in GP, we're realizing this is a valid question.
This is a valid question, yeah.
That is very
every
valid.
day. Okay, but what do you eat? Oh, I have, burger meal every day, and I'm having, 3 cans of Coke daily.
अब ये वाला जो जोक है ना, ये काफ़ी हद तक मुझ पे अप्लाई करता है, इसलिए मैं इसको मूव ऑन करता हूँ. Let's move on to the next one.
He's getting PTSD.
Sure, feels so much connected.
Okay.
Okay, I have a problem like this. I'm not gonna lie. I have to go back and try and figure out what I've prescribed, and then sometimes I'm like, that doesn't make sense. Why would I prescribe this? And then realize it was meant to be something else. I've written like this. I still remember some of the nurses. They'll take a picture, WhatsApp me, and be like, question mark?
Yeah.
Shoaib, you have this problem, but this is...
No, I don't have any problem like that. I've got the
No
best
one
handwriting in the whole world. I mean, what are you saying?
can read your writing.
I reckon if you ask Shoaib to read his own handwriting, he would not be able to read.
Or let's put it the other way. If you ask me to read my own handwriting, probably I'm the only one who would be able to do it. So, and do
I
it properly.
don't think so. You would be able to read by yourself.
Then God bless everyone, because after that you've got no other chance.
God bless us. We could never understand what was the plan.
Literally, it was like, is the DNA in place? I have no idea. Let's take a picture, send it back to him. Ye kya hai? Yes or no?
I think you've done that few times. I do remember that, to be honest.
Yeah.
I remember doing that, being like, I think they're gonna go. Can you please tell me, do I research? No research. I can't read this.
Okay, let's see the next one. Right.
Yeah, he's skateboarding on what?
So he's basically using his hands to do a little toy skateboarding of sorts, and this is what he's trying to show off, and this is Doctor Strange. So I think the whole moral of the story is Doctor Strange is trying to pull off strange things.
I mean, that's pretty strange.
So it's not too funny, is it?
I don't know. I'm not able to connect it. Like, what's that?
Well, I mean,
I can't comment on this. It makes no sense.
for starters, I couldn't even understand the whole point, but this is what I'm actually coming up with. So if anyone knows better, so please text in the comment and tell us.
Oh my god, this is constantly an issue. But to be honest, it's not bad. It's good that they've done some research around in some cases, but I feel like patients can scare themselves to the point where they will think
the
is
treatment
happening. No, so they may just have like I don't know, some sort of joint pain or bone pain, and they'll be like, "That's it, it's cancer. I've read it. Someone had it online, and you're not doing the right tests for me." And then they lose that trust with the doctor.
I agree with it. It's not a bad thing because at least now they are like, okay, like, for example, sometimes it's so funny, like sometimes, they have like pain in the right side and they point out on the left side कि liver में pain हो रहा है.
It's obviously my
And
appendix. On the left, it's
now,
obviously, and you're
and
like,
I'm like,
okay.
at least now the hand is always the right side. So I'm kind of feel happy that थोड़ा सा anatomy का knowledge थोड़ा ठीक हो गया general public का. Yeah, but I agree. Google helps.
Okay, this is interesting.
Okay.
So this is a fact of biology apparently. So I think mitochondrias ये बहुत ही छोटे organelles होते हैं inside a cell, and they are actually inherited from mother. So this is what it's trying to say. इसके बारे में कुछ कहना चाहेंगे आप दोनों? आप लोग माइटोकॉन्ड्रिया तोहफे में देंगे अपने बच्चों को?
I mean, it's true.
Powerhouse of the body. Do you remember?
Powerhouse of the body. Absolutely. The best gift that you can give, isn't it, to the offsprings? Right?
Monali, आपको क्या हो गया? You stop blinking so fast. You're like, what is it?
Right. So this is another video. What it says, I'll read for you guys. It says, physician referred to physiotherapy treatment, writes TENS and ultrasound on their prescription. And this is how physiotherapists behave once they get that, prescription from the physicians.
क्या हम कोई गुलाम हैं कि जो आप कहेंगे हम कर लें? Absolutely.
But I get the gist that they're quite passionately pissed off.
So that's what happens in reality as well, doesn't? So this is a video again. It says, so I can read it for you guys. Let me see if I can just put it to big. So who told you to start antibiotics for this viral upper respiratory tract infection, and how the patients will react? So let's see.
I actually did it myself. Yeah. Nice.
Lol. It depends who's asking.
Myself. Yeah.
It depends the tone in which it's asked.
The way she is happy about it and telling, so proudly.
That means she's very proud of this. I don't know. It depends. If it's a very senior consultant asking and he seems angry, that's when you stay quiet. You're like, shit, I'll delete it now. But if it's just like, I don't know, Monali saying, who prescribed this? I'll be like, I did it.
I actually did it myself. Okay, let's see the next one.
Like resident explaining poor diagnosis to end-stage intubated patient relative. लेकिन juice अनार का पिए मौसमी का.
अच्छा.
Like India, Pakistan में they're only concerned about कि भाई juice कौन सा पिए, भाई मौसमी का पिए, अनार का पिए, कौन सा ठीक है, मैंने ये कर लो पहले.
अच्छा, वैसे एक बात है कि जो पेशेंट्स की फैमिलीज होती हैं उनमें एक ऑब्वियसली एक अनसर्टेनिटी तो काफ़ी होती है ना. दे यूजुअली दे वांट टू नो अबाउट दीज थिंग्स. ओके, राइट, लेट्स सी द नेक्स्ट वन. So what does it mean?
My neighbor's beefing. What is the actual message?
Kiara's home Wi-Fi.
हाँ, लेकिन नीचे से something loud है यार. क्या?
Loud as fuck.
Oh. You know what? That's smart. This is like the epitome of British passive aggressiveness. If your neighbor won't calm down, how do you get to them? Oh, when every time they connect to Wi-Fi, they will read. That this is what they need to do. We won't go around and knock on the door.
No.
We're not going to bang on the walls. Nothing like this. We'll do this.
This is so polite. I mean, you can never see that thing in India. Like they're just gonna shout at the first noise, like, "Shut up!"
Oh my God, no.
Okay, simple, short. I like these ones.
I have a headache.
Oh, this is what I was saying. They do research, and it's obviously going to be the worst case scenario ever. Now, I appreciate that in some cases, yes, a headache will mean, let's say, a tumor growing on the brain. But common things are common, and that's what people forget.
True.
Like, most likely it's a headache before it's a it's attention heading before it's a cancer of the brain.
True.
And if you have no other symptoms, putting you through all of that radiation to get head scans and things is a bit excessive. I don't know. जब हम patients को देखते हैं, we don't turn around and say कि ये करो वो करो. You're not allowed an opinion, है ना? हम कहते हैं कि ये मुझे लग रहा है कि infection है. इसलिए antibiotics आपके लिए ठीक होगा. Would you like it or not? And they will say yes or no. From my impression of like India, Pakistan, that's not the case. They will say, there's your antibiotics, take it, done. So I don't really think it's a similar case in the UK. It's more about patient-centered. If they want it, fine. If they don't, we have to find something else.
No, that's true. That's true. Or Monali, have you practiced in India before?
No, I haven't practiced in India, but I was an intern, and as a medical student, I have seen the both sides, UK ka bhi or India ka bhi. But I haven't practiced as such in India. After graduation, I came here. So.
Did you say fortunately or unfortunately?
But
Did I just hear you say I haven't practiced in India fortunately? Did you just say that?
No, I didn't say that.
Okay, let's see the next one.
I mean, Shoaib and I won't have the last two as a problem.
Absolutely.
So,
me neither.
We'll get to betrayal, depression.
No, I don't even have the middle two as a problem as well, to be honest.
Yeah, internet obsession.
No. The one after early life. Early life and depression.
I was like, you definitely have internet obsession.
I do definitely. That is a problem that I'm proudly owning.
He's currently in denial.
No. I've come to the stage where you start accepting after denial. Finally, yes, I've got the problem.
It's the rise and fall period for sure.
Recovery period.
The recovering.
Absolutely. No, I think इसमें betrayal तो बड़ा एक जुल्म हुआ हुआ है ये. Imagine just asking about this betrayal with patients. We never ask like this, do we? Like do we ask have you been betrayed by someone and do you want to share about that?
I don't know. I don't agree with that. So I don't know what kind of history is it.
That's definitely not a history we ask.
Well, used to go for 10 minutes about the pain.
Okay, let's see the next one. And this is the second last one. Let's have a look. When you're about to die, but Batman's got your back.
Oh my god, I have a friend who would love this. But I would be concerned about that ECG in a patient.
No, definitely. You better be concerned about this, Aqsa.
Absolutely.
If you come laughing to me, telling me about Shoaib, I've got an ECG that you got to look, and if you come laughing to me, this is something to be concerned about. Oh wow, my favorite.
Okay, so Shoaib, if I have never seen you like that. Never. I've seen, let's say, the ENT registrar on nights like that in the med.
Yeah, like that. Yeah.
I've never seen the renal registrar chilling like that.
No, he's not having a good time. Trust me. He looks like he's having all the loads and stresses that you could actually imagine on top of him. So he's not having a good time.
I think it's so wrong about SHO. SHOs are never been like that happy.
To be fair, I've only seen a renal consultant turn up like that.
Who is that?
You know which one. You know which one.
Okay.
I think we should change the consultant with F1 because renal consultants are like F1.
Yeah. I've seen renal consultants like the F1. I've seen Shoaib like the F1.
Yeah, I've seen SHO like F1. So.
No, I always look like an F1 to be honest. I mean, since the beginning.
It's eternal youth. You never age.
Yeah, that's the thing. I mean, I'm aging in the reverse, direction.
Oh my god.
All right, everyone. This was a pleasure talking to two of my most favorite juniors. And we really had a blast today. We went through a lot of memes and we really had a good time and fun today. I would say thank you so much, Aqsa, for joining us today.
Thank you for having me.
Pleasure's all mine. Okay, right? And thank you so much, Monali, for joining me as well. This was a great outing today.
Outing from inside.
Absolutely. Thank you so much, both of you, for joining me today. And we will see you again, hopefully, with another one of these videos. And we'll try to get more guests on our show as well so that we will have a blast together. So thank you so much, everyone, for watching us today. We will come back again with another one of these videos. If you like, please like the video, share it, and do remember to leave your comments in the comment section. Thank you so much again, and we'll see you again. Allah Hafiz.
Bye.